Hello, everybody. Welcome to Community Spotlight hosted by CASA of Tulare County. I'm Alberto Ramos, the Executive Director at CASA, and I'm here happy to be joined by our friends at Tulare County Health and Human Services Agency. As you know, our Spotlight is dedicated to highlighting our partnerships and all the important people and organizations that collaborate with CASA to do this wonderful work for children and families in our community. So, would you like to introduce yourselves?
Sure. I'm Dr. Natalie Bolín, and I am the Behavioral Health Director with Health and Human Services in Tulare County.
My name is Francena Martinez, and I'm the Human Services Director for HHSA.
Gilbert Rivas, Deputy Director with Child Welfare Services.
Our partnership with Health and Human Services Agency is extremely important. Child welfare and mental health departments in particular are ones that we, more than any other organization or a nonprofit or governmental organization, we collaborate with them, we work with them more on the front lines with children in need and with families in need. And so I thought it was very important for us to come and have a conversation so that you all can understand that CASA does not do this alone. We do not work in a silo. We do this work through a collaborative approach, and so I'm very happy that we get to highlight that today. So there's many things, right? There's the bulk of our advocacy is done in constant communication with child welfare services agencies, social workers, for example. We work on a daily basis. We do our work. We're in constant communication with various social workers about the cases that they are responsible for, right? And so, in the perfect world, judges would be able to come and visit these kids who are in the foster care system, find out what they need, what they want, and what their input is for resolution of the case that they're in, right? And so, unfortunately, that's not possible. There's there's about 900 children in the foster care system. We have 3 judges in our dependency system, and it's not feasible for them to do their duties in court and then be able to come and visit kids. And so similarly, we help bridge a gap with our partners at Child Welfare Services in a similar capacity, because social workers have a lot of work to do, most intensively with helping parents heal, helping provide parents with appropriate interventions and case management and other types of supports so that they can rectify the situations that led to the removal or the disconnect from being able to be the care providers of their kids, and be able to join them again with different circumstances, with a different perspective, and be able to provide a safe and nurturing home and environment. And so our volunteers are seeing these kids once a week, typically once a week. So they're getting to know the kids very well. And so through these visits, they're able to find out what they need, what they want. They develop trust-based relationships with them. And from that comes the information they need to be able to advocate for these kids in court and outside of court, in meetings. And so our partners at Mental Health, we're in constant meetings with them, CFT meetings with their team, and trying to determine what do we need to do, what do we need to do to help this kid, what do we need to do to help this family. And so our volunteers become the voice, are the voice for the kids, and a community voice in a way, because they're coming in and learning about what's going on, how the system is running, and at times they can actually end up affecting legal changes in the system through different types of advocacy, thanks to their involvement through CASA or through any other means.
But what you said, Albert, was so important because they're a voice for the kids. And when these kiddos come into mental health for treatment, a lot of times they don't have that emotional literacy or words to put to how they're feeling. It's really hard for them to explain their situation. And so having a CASA advocate be their voice is really important to treatment. And so we are always really happy when we see kiddos come in with a CASA advocate.
And on the CWS side, the important thing is that we all have a shared mission, right? The child's safety, well-being, and ultimately their permanency plan, their permanency goal. And so the collaboration between mental health, CASA, and CWS, being able to advocate and make those decisions, and be able to, for CASA to be that voice, the eyes and ears, as you were saying, for the court system, so that we were having better outcomes with our court reports, that the information that's being presented to the judges is coming from somebody that is there in the child's life most of the time for all the time that they've been in independency. And so having that CASA advocate is vital to the permanency plan and outcomes that we want for our children in foster care.
And the collaboration between the CASA volunteer and the youth is different in the way that it's personable. The child still is going to link it to what's going on in their life, of course, but they get to have a different relationship with their CASA volunteer. Otherwise, the only relationship they would have with their social worker is really situational, right? And while still important to the process, the impact is definitely different. And so having someone with a CASA that's coming behind them and with on their side where they've been able to, like you said, build that trust, build a partnership. That is a different lens coming from a child's point of view. You guys did a video not too long ago about these types of situations from a children's lens, right? And so when we look at that from an adult lens, there's the professional side, which is where we're all coming from. Although we'd like to be much more personable in that environment, there's just a requirement for the professional check boxes to make sure that we're meeting the child's needs, the family's needs, the court's needs, and then supporting our partners along the way. And you guys are doing the same. So when we have volunteers like CASAs that come in and they're spending that personal time with those kids and really helping them feel normalized in this situation, then they come into things like what Natalie's saying and like what Gilbert is saying. They come into their treatment with a little bit less of a stigma attached to them. They feel like they have more support. And so what CASA does, it's irreplaceable in my opinion.
Yeah, and it totally is. And what you touched on was really important is the connection and consistency. And so for kids to work on their mental health or to be successful in school, a lot of times they need consistent connection with individuals. And for some kids and families, that's what's missing. And they can connect with their social worker, but sometimes social workers change. They can connect with a therapist, but sometimes therapists change. And I remember when I worked in child welfare 18 years ago and working with CASA, you had CASA advocates that had been in a CASA volunteer for 18 years. I think I remember Pierre, who was, he was
He's a good guy.
He's such a good guy and longest stand. I think wasn't he the longest standing?
Yeah, over 300 kids' lives he'd impacted, over 10,000 hours of advocacy. Yeah, he's an amazing human being, Mr. Pierre.
And he was an advocate. I had a case for 10 years and he was the same advocate.
Wow.
Yeah.
How cool. I didn't know that you got to connect with Pierre
I did.
on one of his cases.
Yeah, a couple of them actually. Yeah.
So we had a funny story. One of our staff members was at, I believe it was Hobby Lobby, and they had their CASA pin on. And the young man at the counter helping this person, which is one of our staff members, not volunteer, said, "Hey, I had a CASA when I was in the foster care system." And well, it turned out it was Pierre. And this kid's like, "He saved my life. Is he still there?" And yeah, he was able to reconnect with Pierre many years later. But one of the lives that Pierre got to impact. And I think for us, though, the point I want to make is here in this is the you three being here is a testament to this reality that in Tulare County we have really good relationships, right? And we can't do this work. Pierre can't do this work if not for people like you who understand there's different pieces to this puzzle, right, that we're working on. Versus stories I hear of child welfare many years ago where it was all on a social worker, right? Like all this burden and all of this work, all of this, the burden of the decision making and the outcomes and the consequences of decision making, it's all on the social worker. That's what I've heard, right? But I see it different now. Well, I've been with CASA for almost 15 years, and since I've been on board, there's always been this really collaborative spirit in Tulare County with Health and Human Services Agency, mental health, child welfare, but extended through other nonprofit partnerships with family services and many others, countless others. And it's almost like a really cohesive unit, right? And so I'm very grateful to step into this and be a caretaker of these relationships and be a caretaker for an organization like CASA and help move it forward through the challenges that lie ahead.